So when the pandemic hit, I remember watching the news and thinking, well, this won't affect me. This is something that will help, maybe the primary care doctors, maybe hospitals, not me. And, but I had patients showing up in my office because I'm an ear, nose, and throat doctor. I do get people that have these stubborn infections, stubborn sinus infections, or cough that won't go away. And so when COVID hit, I had people coming to see me for these persistent infections. And I remember very clearly my first COVID patient because it was a teenager who had just come back from China. And she just had this cough that wouldn't quit. And, I remember talking to her mother, do you think this is COVID? She was just in China. We thought, oh, no way. Well, yeah, more and more I had patients trickling in with the same thing. And so I just did the best I could. I used common sense because we really didn't have much to deal with. And we were taught in medical school that you can't treat viruses. And that's how I entered the pandemic, feeling like, okay, well, you can't treat viruses. We don't have an antibiotic for viruses. So I used common sense and I used breathing treatments and I treated for possible secondary infection with antibiotics. I used steroids and then I used hydroxychloroquine. But actually, Texas shut us down from that. I never had that happen before. The Texas State Board of Pharmacy just said you're not allowed to use hydroxychloroquine. And I listened to them. I put it on the back burner, but I did the best I could. And then I started using monoclonal antibodies, and those worked really well. People would get better the next day. I rarely had anybody complain about side effects. And initially I could get as many doses as I wanted. And then the government took over and it became harder and harder to get monoclonal antibodies. And so I started using ivermectin. I didn't realize the ban on hydroxychloroquine was eventually lifted, but I wasn't even aware of that. So I used ivermectin and monoclonal antibodies and found that the ivermectin worked just as well as monoclonal antibodies. But I got in real trouble because, I'm in Houston, and Houston Methodist Hospital was the first in the country to mandate the COVID shots. And they did it 5 months before Biden. This was April 1st, 2021.